Now, please bend both of your knees. Bring your knees back to standing. Hug yourself, putting your right hand under your left armpit. Put your right hand under your left armpit, and left hand cover your shoulder. Left hand on your left arm or left shoulder. Right hand under your left armpit, holding on to those ribs that you saw on the model. And the right hand covers your shoulder or arm. Now, as you lift your right inside border of your foot, the right inside border, as you're tilting the knee out to the right, very gently pull with your right hand your ribs to the left, allowing your head, allowing your chest to roll to the left. So the right foot inside border lifts. The right knee opens a little bit to the right. Your pelvis is starting to roll to the right. And feel if your right hand could put the ribs, left ribs, so the whole rib cage turns to the right. And feel whether if we could zoom in, like we zoomed in the anatomy app, into your lumbar spine, would it be possible to roll over free of twisting, free of bending, free of arching? If you could make this gentle movement of whole body rolling like a cylinder to the right, and then come back. Exhale as you do it. Don't do big, fast movement. It's better not to roll over all the way onto your side, but just start the first 5 degrees, but do it right. If you're getting impatient and you're trying to yank your ribs or spine or pelvis, you're far from having the spine quiet, easy rolling, going with the flow. Beautiful. Stop. Stretch out your arms and stretch out your legs. Feel perhaps we just did the right side. We didn't do the left side. Feel if the right side is more open. The right leg feels a little bit longer or more open, or something let go. Maybe your back is closer to the floor on one side. Watch your breathing again, how the right lung is drawing the air in, how you're expanding your right chest inside your thorax, inside cavity of your chest, into your shoulder blade, into your collarbone, into your diaphragm, into your belly, into your lower back. Are you breathing there? Please bend both of your knees. This time, hug yourself the opposite way. Your left hand under your right armpit, right hand over the shoulder. And feel, by the way, is this your more habitual hugging, or non-habitual? Does it feel more awkward, or does it feel just right? Go ahead, switch over and feel. You will have an illustration what habits feel like. We all do this with interlacing your fingers, with crossing one leg over the other, with crossing forearms on our chest. And also in hugging ourselves. One way it will feel kind of just right, familiar, habitual. And the other way, it will feel awkward. It will feel strange. And the strangeness doesn't matter if you're right-handed or left-handed. It's just a matter that long, long ago, your brain created a pattern of movement, and it rehearsed thousands and thousands of ways, thousands and thousands of times, and it became so familiar. And the other one is like, oh, it feels almost wrong. And now go ahead, roll the left foot toward the outside border and pull with your left hand your right ribs, allowing your head to roll to the left, allowing your chest to roll to the left. And you go back and forth, less effort. Feel, can you get a black belt of what we're doing by doing less, not by doing more? It's not that you do bigger movement, faster movement that you get better. Can you learn to move that it will feel like somebody could blow air on you and the body would roll just so lightly, so gently. And sense, how is this side for you? Is it easier to do it to this side? Is it more difficult, or is it fairly symmetrical from right to left? Picture your lumbar spine, your thorax, your whole chest with those ribs that connect between two vertebrae. Using that fixation of the ribs to move two segments. And now using the foot and knee to roll the pelvis. Can the pelvis and thorax start to roll pretty much just like one piece without displacement? This way, even the most vulnerable back could learn to roll over, learn to move. Even the most vulnerable, hot, acute spine can learn how to move like that. Beautiful. Stop, stretch out your legs and rest.